So penicillin skin testing has recently been incorporated in the inpatient setting in several large academic centers and even some smaller community hospitals as well. The goal of the penicillin skin testing is to increase beta-lactam use and subsequently decrease some costs in the hospital setting that are associated with just better antibiotic selection. And with this goal in mind, they have been effective. So if you can show that the patient's not going to have an anaphylactoid-like reaction to penicillin, prescribers then become more comfortable in using a beta-lactam. So in that specific analysis, they are effective at changing prescriber habits. I would argue that it's ultimately not necessary. When you have the penicillin skin testing is about 96% of the patients will be negative. When you have a test that 96% of people will be negative for, is that test truly necessary? Can we just go ahead and use the beta-lactam without having to use the penicillin skin test? So that's really, I think, where we're at. So can you educate providers into using beta-lactams in these patients, or do you need to have an objective test that eases the anxiety associated with it? And I think that would be a very interesting comparison to add to the literature and something that's worth evaluating. Another question that we don't really know yet about penicillin skin testing is when it truly is an intervention that needs to be taken, that would be economically beneficial. So if you have, for instance, if you're an institution that already uses beta-lactams and 90% of the patients that are penicillin skin tests or that carry the penicillin allergy label, is introducing a penicillin skin testing service, which is quite an undertaking and certainly requires a lot of man hours to operate, is that worth it for that extra 10%? Or maybe an institution that has more of a rating of 50% of the patients that are labeled penicillin allergic are getting non-beta-lactams. Maybe that, finding that tipping point of what percent of sort of poor prescribing for this patient population is worth it in terms of incorporating this service versus doing more of a really focused educational effort on what's the best and safest antibiotic for patients that are labeled as penicillin allergic.